Welcome to Successful Philanthropy. I'm your host, Jean Shafiroff. This show is designed to highlight the work of philanthropic leaders here in the United States and then beyond. Today with us, a wonderful woman. Her name, Julie Ratner. And Julie Ratner is the founder of the Ellen Hermanson Foundation. Let's all welcome Julie Ratner. And Julie, it is so great to have you with us. And Julie, I want to start with why you got involved as the founder of the Ellen Hermanson Foundation. Was this an honor of someone, and what propelled you forward?
It is an honor of someone and in memory of someone, my younger sister, Ellen Hermanson, who was diagnosed with stage 4 metastatic breast cancer in 1989 when she was 36 years old and had a 6-month-old baby. My sister was heroic in her battle with breast cancer, and she, with her waning strength, with her diminishing time, used her time to really help other women to have access to state-of-the-art breast health care, or what was state-of-the-art in the early 90s. And so my sister passed away in April 1995. My niece was only 6 years old, and I lost my best friend. And I started this in a way as an homage to Ellen, and also to carry on the work that was so important that she started. And equally as important, I wanted to make sure that her daughter would never forget that she had a spectacular mother. And that's how it began.
And so you did this in honor of your sister, who was fighting breast cancer and who was an advocate for breast cancer and breast cancer treatments and then a cure. And what exactly, Julie, does the Ellen Hermanson Foundation do?
We have a very simple mission. And what we do is we always keep that mission front and center to everything we do, for all that we program. And the mission is to ensure access to state-of-the-art breast health care and enable people affected by cancer. And with that broad mission in mind, we do whatever we can to make sure that here on the East End, there is access to quality breast health care. And that can be screenings, from the medical side, as well as the psychosocial side, because we all know that the head and the mind and the body and the soul are inextricably linked, and what happens in our head can affect our body and vice versa. And so that's our mission, and we have enabled the mission, and we are always working to fulfill the mission, starting with, we started many years ago, but say in our less distant past. In 2009, we opened the Ellen Hermanson Breast Center. The foundation funded the Ellen Hermanson Breast Center, which is a self-contained facility within Stony Brook Southampton Hospital. And it is our goal and intention to always make sure that this facility is technologically advanced, that the doctors and the staff are warm and inviting and welcoming and reassuring to the patients who come there. In addition, in 2000, we started a program called Ellen's Well, and other programs have emanated from that. Ellen's Well is basically to provide psychosocial support, and all our programs are done free of charge through Ellen's Well. And also, I'm proud to say that at the Ellen Hermanson Breast Center, one of our caveats when we were asked to do this is to make sure that no one is turned away due to a lack of health insurance, so that any woman will be seen and get the care she needs.
And that is so important, that healthcare is available to everyone and not just to people with insurance, because we've just gone through this terrible pandemic. We're still in the throes of it, but life goes on, and hopefully we are going to emerge soon out of the pandemic. But when you think about all the millions of people who have lost jobs and as a result don't have health insurance, it's very important to know that people who don't have health insurance have a place to go. And Stony Brook Southampton Hospital is one of those places. And then the Ellen Hermanson Foundation is making it possible for people to go and be seen and be treated should they have breast cancer. Now, let's start with breast cancer. There are so many different theories as to why women come down with breast cancer. There are theories about chlorine in the water. There are theories about birth control pills, too many hormones in a woman's body. There are a million different theories. Julie, do you have any idea what causes breast cancer?
No. And I read about this, and I know that there are minds far better than mine that are, certainly involved in the science of breast cancer, trying to figure this out. Do we know that much of it is environmental? When I say we, I mean the largest science world, not me. Yes, much of breast cancer is all environmental. We know certainly that women who have the BRCA mutation are more susceptible to breast cancer. If you have BRCA 1 or 2, A or B, then you're 80% more likely to develop breast cancer and 40% more likely to develop ovarian cancer. So there is a genetic component, but that only accounts for a fairly small portion of breast cancer cases. There are so many theories, and I hesitate to opine about it. I will say that I heard Dr. Larry Norton speak 2 weeks ago, and he talked about the fact that there are many theories as to whether it could be possibly viral and how to look at breast cancer. And that people who study breast cancer are now collaborating with other sciences to try to figure out through mathematical models and other sciences, astronomy, space, using these other technologies, other modalities of thinking, and bringing it to the study of breast cancer. I'm not enough of a scientist to understand it. I felt when I heard Dr. Norton speak, I understood every word he said, and I can't explain it except it was fascinating. And the idea of thinking outside the box to try to find solutions is really important. That I got, and I think that might prove to be very, very beneficial someday.
Yes. Now, I've read in many places that Long Island has one of the highest breast cancer rates in the United States. Any thoughts on that, Julie?
Well, I wondered, is it due to the groundwater, to the pesticides, to the fertilizers, to all the farming that was done here? Is it due to any of the nuclear plants that have been around? I mean, there are questions, and we've all asked these questions. I don't think that any of the research has really proved definitive. So I don't know. I wish I did know, because I get asked this question all the time.
And what about a diet? I used to read a lot that if we changed our diet, it was more plant-based, less meat-oriented, that diet did play a role in preventing breast cancer. And then also, if someone came down with breast cancer, that a more plant-based diet would help them have the cancer grow slower. Do you believe in all of this?
I think diet, yeah, I don't know if I believe quite exactly all that you said. I think diet is critical to our health. And I think that the research has shown that certain diets are really unhealthy for us. And that when I hear researchers and scientists talk about the healthiest diet, it's usually the Mediterranean diet, which is heavily plant-based. Proteins are, plant-based proteins, more whole grains. And there was a book I read a number of years ago called The China Study. And I think the doctor's last name who wrote it was Campbell. I don't remember his first name. And he talked about the benefits of a plant-based diet. He also talked about, he did his research in other parts of the world, showing that people who were living on a plant-based diet tended to be healthier. There was less heart disease, less diabetes, less cancer, less some of the big three and other diseases or that cause comorbidities. And that often he would cite these countries and how people would immigrate from these countries to America and then start eating an American diet with a high fat content, a lot of junk food, and that their weight would go up and they would become part of the regular population in terms of diagnosis. It was a pretty interesting book. And I just recommend it as an interesting book. And there's been so much written about diet and its effect on the whole body.
Yes, and no question, a more plant-based diet or the Mediterranean diet, where someone eats a lot of vegetables and chicken and fish versus a lot of red meat and greasy fried foods. Well, it's a healthier diet. You'll stay thinner and hopefully healthier. Now, Julie, what about prevention of breast cancer besides diet? Mammograms. All women are told to go, most of them for an annual mammogram or twice every 2 years a mammogram. What are your thoughts on this?
I think mammograms are probably still the best defense, as well as self-examination. Knowing, for a woman to know her own body is really important. Many women discover their own lumps by self-examination if they find the mass in their breast. I think that's really important. I think it's controversial. The whole mammogram issue is controversial. When to start, how often to have one, is it really effective? There's all this research on the statistical research. Personally, and it's not based so much on science, I think going every year, yes, you are getting some radiation, but I think it's also the only way to know in early, and it might be your life that is saved. Do mammograms save lives? No, but they can tell you if you need to have treatment and if you need to take care of yourself and do something. And they save your life that way. It's unclear how much mammograms reduce the death rate, and there's a whole lot of literature on that. However, if it's your life, it's a pretty important life.
Yes, and if a mammogram or a sonogram detects a cancer early, well, that's a reason to get one. And I think that's why the doctors are prescribing them. And I think that early detection of any disease or any ailment is a good thing. And during this pandemic, Julie, have we seen a rise in the number of cases of breast cancer, or is it about the same?
What I've read is, I don't know if you'd call it a rise, but women are coming in and being diagnosed at later stages because during the pandemic, they couldn't be seen, for months. Even our own Ellen Hermanson Breast Center was closed to routine screening. It was available for diagnostic screening if someone found something, but many cancers are found on a routine screening, and that was closed. And because of the whole COVID pandemic, where people tended to stay away, not go to doctors, not do anything that wasn't absolutely necessary, very often many of these cancers are being found at a later stage, which complicates the issue.
And that's very unfortunate. Now, Julie, I'm involved with Southampton Hospital. I'm on the board of the Southampton Hospital Association, and I want to thank you from the hospital. All of us thank you for all you've done for the breast center at the Stony Brook Southampton Hospital, because each year the Ellen Hermanson Foundation makes a donation of about $200,000 every year to the breast center. And so here you are, a woman, Julie Ratner, you've started a charity on your own in honor of your sister who passed away from breast cancer. She was an activist and advocate for breast cancer victims. And when she passed away, you and I think another sister of yours started the foundation, and you are doing tremendous good for the women on the eastern end of Long Island. And I really want to thank you. And you serve as a great philanthropist and a great role model for others. And since this show is about philanthropy, Julie, I want to hear about your upcoming fundraising gala. I'm involved. I'm the chairwoman of the gala. It's August 28th. But let's hear in your words, because it's so important for the Ellen Hermanson Foundation to have a fundraiser, to get out there and raise money so that they can continue to do the work you do that is so important for so many thousands of women living on the eastern end of Long Island.
So you are correct. We are having our fundraiser 2 weeks from this past Saturday, or a week from this coming Saturday, August 28th. It's going to be at Hampton Racquet Club on Buckskill Road in East Hampton, and we are planning a really fun, spectacular event. Last year, we did our event by Zoom, and it was wonderful. It was fun. It was lovely. there's no substitute for being together in person. We are, I have to say, still concerned about COVID and the Delta variant. And with that in mind, we had originally planned to be indoors at the clubhouse at East Hampton Indoor Tennis, because it's a beautiful facility, and Holly and Scott are lovely people. However, with the spread of the Delta variant and the news that we're hearing, we decided as a health organization, we could not really hold our event indoors. We spoke to the folks at Hampton Racquet Club, John Graham, who's actually one of our honorees, and his sister Monica, and decided we would move it there. And so everyone has been lovely. The Grahams have been wonderful. The Rubensteins have been wonderful. And we are planning this fabulous event under a tent. There's a restaurant at this racquet club called V as in Vietnam, V Cafe. And the chef there is a Vietnamese chef, and her food is spectacular. So we're going to have gorgeous banquet of Vietnamese food. Lynn Blue will be and her band will be the entertainment. We have a wonderful Robert Altman MC. We're honoring Tova Felchu, who's a dear friend, a spectacular actor, and also a great, great friend to the foundation. And in her own way, as an actor and a consummate artist, a role model. And John Graham, as I said, one of the co-owners of this tennis club, who in my opinion is the Pied Piper of tennis, who brings so much joy to what he does, his work with children. It is in the honesty, the integrity, his intent to help children be the best that they can be. And after all, children are the inheritors. They're the ones who are going to take this world over. I love what he's doing. So that's our event. We'll have a live auction. We'll have a small silent auction. We'll have great food. You're our honorary chair, so we know we have a great chair. It's going to be a terrific event, and we hope to raise lots and lots of money. You know, this year we started a partnership with some local women's organizations, with the Shinnecock Health Services, the center, in Bridgehampton, the Bridgehampton Child Care Center, OLA, and the Retreat, because women who partake of these organizations are all women who live on the margins, and women whom we know are not getting the services they need in a timely fashion. A woman who's living under stress, who's the head of a family, who's possibly in an abusive relationship. There's so many women have such complicated lives. Their own health is often on the very back burner of the stove, and it just doesn't get to the forefront. And we want to make sure that these women are being served. So we've started this collaboration to really work on making sure that these women are in the pipeline early and often enough.
And Julie, how can our viewers purchase tickets
good
to
question.
the gala, and how can they make a donation if someone can't attend a gala, but you still want to donate, you love the cause? Your donation is so greatly appreciated. And I say to people, because I've written a book on philanthropy called Successful Philanthropy, How to Make a Life by What You Give. If you can write a big check, I think that's a great thing. And those that have resources have an absolute responsibility and obligation to be generous. But no one can give to every single cause. However, if you have a modest income and you want to get involved by donating, Julie, what's the website? And any donation is always accepted. And of course, we want more people to come to the gala. The gala is going to be great. I'm very excited to chair it again. I've chaired it for many years. To work with Julie Ratner and her team is fantastic. So Julie, what's the website?
Our website is ellenhermanson.org. That's ELLENHERMANSON.org. And if you go to the website, it's chock full of information. And one of the first things that comes up is our gala on August 28th. There's a link for more information and to register, where you can register if you can't come and you want to just make a donation. It's all on this registration page. And I agree with you. We love when someone can make a substantial donation. It means the world to us. Every donation we get is a gift, and I'm so grateful. For some people, as you say, a modest donation is what's comfortable and affordable for them. That makes their gift just as wonderful, in my opinion, as a gift that has many more zeros after it. because each of us is doing the best we can. And I would never want anyone to feel that his or her gift is diminished because it's not big enough.
And for those who want to volunteer and help the Ellen Hermanson Foundation, how do they do that, Julie?
Just reach out to us. We just had our run yesterday, the 26th annual Ellen's Run at the intermediate school. We had so many calls of people who wanted to volunteer. And we had this host of fabulous volunteers. And again, volunteers make an event. You know this as well as I do. They bring their great gift of time, energy, and belief in what you're doing. And that brings a kind of energy to the whole day, and ambiance that just spread throughout the whole event. It was wonderful, and it happens all the time. Volunteers are a treasure, and we welcome anyone who wants to volunteer with us. Just
And then
go to our website.
And Julie, during the year, do you have volunteer opportunities as well in the winter? If a woman is living out here or a man and they want to get involved in volunteering, because you've created a wonderful community of people who love to support you, love to be involved in the run, and love to volunteer for your organization.
Well, as you know, our organization is pretty much an event-driven organization, and we always have a winter event. And there will be opportunities to volunteer for the winter event. It's a little quieter during the winter here. We do work on a winter event. We have an end of the year appeal. We do fundraising, a lot of fundraising. It's less volunteer specific, though we will always find something useful for a volunteer to do that will be meaningful.
Yes, and for our audience, we are with Julie Ratner. She is the co-founder of the Ellen Hermanson Foundation. And Julie has briefed us on her charity, which is involved in promoting breast wellness and then helping women who have come down with breast cancer on the eastern end of Long Island. This charity is very involved in supporting the breast center at Stony Brook Southampton Hospital. And Julie is very involved in continuing the legacy of her sister, Ellen Hermanson, who passed away many years ago of breast cancer. And Julie, we just have a few minutes left. What advice do you give to our audience, to young people who maybe want to get involved with a cause such as yours? What should they do?
Start with making a phone call. And if that's what you want, and talk to people and get a sense of what it is that the organization does and whether it fits with what you're interested in. There is, to your point, there are so many important causes and worthy causes. And I think it is the non-government organizations and philanthropy that keeps our country going. We welcome every single phone call. And I'm sure, but it begins with a phone call and knowing what the organization does. And if you think it's interesting, but you're not sure what it does, certainly call. If you call us at the Ellen Hermanson Foundation, we're always ready to speak, and we want to speak to you. And we would value your gift of time and energy and input. It will make us a better, stronger organization within the community.
Julie, thank you very much for joining us today. This concludes Successful Philanthropy. Our guest, Dr. Julie Ratner. She is the co-founder and president of the Ellen Hermanson Foundation. I'm Jean Shafiroff, your host. I'll see you next week.